The spine serves as the backbone of the body, both literally and figuratively. When disorders affect this critical support system, it can lead to a myriad of challenges. That's when modern medicine comes into play. From robotic-assisted spine surgery and disc replacement surgery to 3D printed implants, innovations in spine surgery are revolutionizing how we treat spinal conditions, offering patients quicker recovery times and better outcomes. Today, we'll explore the latest advancements that are pushing the boundaries of what's possible in spinal care and answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgi Brusavanik, a minimally invasive spine surgeon, and today we're going to be talking about recent advancements, innovations in spine surgery and how they work. Let's kick things off with a Facebook question from Theo. Theo asks, "Hi, Dr. Brusavanik. My older brother, Philip, just found out that he needs fusion surgery for spinal stenosis. I've heard that fusing the vertebra can severely limit your mobility. Is there another type of surgery he can have that's not so drastic or invasive?" Theo, I'm so glad that you asked these questions. Thank you for reaching out. So stenosis means narrowing of the canal. Patients who have stenosis will say that they have a significant limitations in how far they can walk. So they'll also say that they can sit comfortably. If your brother has a difficult time sitting, then he probably has something besides stenosis, such as a degenerative disc that is symptomatic. And then fusion surgery may help, disc replacement may help. So I would talk to your doc about why does he need a fusion surgery? Is the stenosis so severe that there's no way to decompress the canal? Because in general, when patients come to me and say they have stenosis and limitations in walking, but no real difficulty sitting, you could sneak in and do a really a very elegant, minimally invasive operation where you decompress the canal, create just a little bit more space for the nerves, and patients do amazing. They get up and go walking, and they say that their old symptoms are gone. A lot of these patients say they have a difficult time standing up straight. So that just disappears right after surgery. Thank you again for your question, Theo. Our next question comes to us from Michael, who reaches out to us on our very own website, allhealthtv.com. Michael asks, "Doctor, I'm a former weightlifter, and I was recently diagnosed with spondy something or other. I can't say it, so forget about spelling it. The surgeon said he's going to fuse my spine together. I don't know about you, but I don't want my spine fused." This is very similar to the previous question about whether a fusion is necessary. My wife said I should ask you about getting some stem cells. She remembers seeing something about it on TV. What do you think? Mihail, first, thank you for reaching out to us with your question. And speaking of question, this is a really good one. Before I answer, let's check out this video from the good folks at Mayo Clinic. I have a difficult time with stem cells because I've been involved with stem cell research for a while now, and stem cells are like babies. If you place them if you place babies in the middle of Wall Street, uh, there's no guarantee that they're going to become great traders stem cells need direction. They need humors and mediators to stimulate their development. And stem cells have become really glorified, I think, beyond what they are able to accomplish. So I would I would beware, and I would really ask all the right questions about this particular clinic and stem cell involvement. Now, going back to your question, Mikhail, so a fusion for spondylolisthesis, probably that's what your brother has. And that's probably, Theo, and that's probably what you have as a weightlifter. Spondylolisthesis is very much amenable to fusion if it causes your pain. Now, with spondylolisthesis, pain is with sitting, pain is with bending backwards. And as a weightlifter, you may remember that when you used to stretch backwards like in a bridge, you could say, well, that used to be my very painful position. That means that the spondylolisthesis is actually relevant. You see, there are a lot of changes in your spine that may be present on imaging, but aren't actually causing your pain. And you're right, Theo, that a fused spine is not a normal spine. You don't want to lose mobility. So I'm not sure if stem cells are necessarily the answer, but I also don't want you to rush into a fusion surgery. First, get a second opinion and make sure that your doctor tells you exactly and understands exactly where the pain is coming from. And then if it's reasonable, then a minimally invasive fusion may really take away your pain, because spondylolisthesis is very much correlated with back pain. I hope this helps. Bianca just reached out to us on our Instagram page, and the question for me is, hi, Dr. B. My father might have to get surgery on his spine. He was trimming the hedges in our backyard, and he fell off the ladder. Bianca, I'm so sorry. Anyway, I've been hearing more and more about minimally invasive surgery. What is it exactly? Bianca, I personally love this question, and it just so happens that I'm a minimally invasive spine surgeon, so this is right up my alley. But before I share my in-depth knowledge with you, let's check out this video from our partners at Baptist Health.
The minimally invasive spine surgery is something that can be used to address all sorts of spine pathology. Typically, minimally invasive techniques are used for the lumbar spine for treatment of sciatica, treatment of deformities, treatment of degenerative disc disease. I typically prefer minimally invasive spine surgery whenever possible because it results in less tissue injury, less blood loss, and in the end, the patients are able to recover quicker from surgery. The recovery process from a minimally invasive spine surgery is fairly quick. Patients typically arrive to the hospital in the morning, have surgery, and 4 hours after surgery, we have them walking around the halls with the physical therapists and the nursing staff. It's usually one night in the hospital, and by 2 to 4 weeks, they're back at work. Spine surgery can cause a lot of apprehension in patients, mostly due to things they've heard from friends, relatives. With any type of surgery, I think one has to be all in because, right, surgery slows you down. It hurts. But I think that with minimally invasive techniques, the recovery can be shortened. People can be back at work pretty quickly. And I think that in the end, we can see a really meaningful return in function.
Let's go back to Bianca's question. Bianca's father fell while trimming these hedges. And the most common fracture that you see in the elderly is what's called a compression fracture, where the vertebral body just sort of crushes down. These are luckily very stable fractures, and oftentimes patients are able to avoid surgery, Bianca. But if your father's been suffering for a while, there is a minimally invasive technique where we introduce a needle through the skin, through the bone, right into the front of the spinal column, where the crushed bone is causing his pain. And we inflate a balloon that sort of gets the bone back up to its original height. and then we withdraw the balloon all through that one needle. And then we inject some cement or glue. It hardens fairly quickly, and it keeps the bone in a stabilized position. It's an amazing procedure called a kyphoplasty, and if the fracture is indeed the cause of your father's pain, then when he wakes up from the procedure, which takes about 20, 30 minutes, he will say that his pain is gone. It's really rewarding. I'm happy to help, and I hope that it's something so minor as a compression fracture. It could be something worse, burst fracture. Obviously it's impossible for me to diagnose just with your question, but make sure you get a second opinion if you have any questions about whether what you're getting is the right thing. In case you missed it the first time, here is another opportunity to find out exactly where to send in your questions.
Robotic spine surgery is the use of...
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Luca just sent us a question from our YouTube page. Luca's question is, hi, Dr. B, can you please explain the benefits of using 3D printing technology in spine surgery, as well as tell me how it works? Well, Luca, 3D printing is just as you imagine. It's a cool technology. It's a useful tool for surgery, like for surgeons like myself, particularly because everyone's a little different. Now, we have implants to replace discs, replace bones, and the companies that provide us these implants will bring in hundreds and hundreds of options into the operating room so that we can fit it best for the patient. But what if it still doesn't fit perfectly? Well, in that case, a CAT scan performed before surgery will provide the useful information that is then used by the 3D printer to create the model of the implant that fits the patient perfectly. Now, there are some innovative companies in the realm of spine that are already using this technology. It is still sort of new, and we're still waiting to see really the long-term benefits of such. But this is not something imaginary. This is really happening in the world of spine surgery. We've got another question from allhealthtv.com. You should really check out this page. It's chock full of very useful information. Enzo asks, hey, Doc, I played hoops in college. I was pretty good too, but during one game I went up for a rebound and I got hammered. Not only did I have a concussion, but I screwed up my back too. It's gotten worse over the years, and now I've been diagnosed with sciatica. So I talked to a surgeon, and I guess I'm a qualified candidate for robotic surgery. So I'm not too sure. I'm digging the idea of a robot doing surgery. It sounds a little too futuristic for me. Doc, what do you think? Enzo, you're hilarious. Let's check out this video from Mayo Clinic, and then we can talk about the Star Wars of spine surgery.
It's for robotic spinal surgery. Robotic spine surgery is the use of robotic guidance for the placement of spinal instrumentation. When we do surgery on the spine, generally there are two main reasons to do surgery. One is decompression. If the nerve roots or the spinal cord is compressed, we decompress the nerves or the spinal cord. And two is instability. If there's instability of the spinal cord, we may have to stabilize or perform a fusion. Our hope is that by bringing enabling technologies into the operating room, technologies like robotic surgery or navigation-guided surgery, that we can make surgery safer, faster, and more reproducible, and hopefully be able to benefit more patients. With robotic-assisted surgery, some people have the conception that the robot's doing the work and the surgeon may be off in a different location. And although I don't want to predict what might happen in the future, technology is rapidly changing. Today, robotic-assisted surgery does still involve the surgeon right at the surgical table of the patient. So if you were a patient and you were looking into a surgery where a robotic-assisted spinal surgery is happening, you would still see the primary surgeon at the table, an assistant surgeon across the table from that primary surgeon, and the robotic arm next to the primary surgeon moving into the locations that the primary surgeon has identified for it to move into. qualified candidates.
That's a really great video. Enzo, robotic spine surgery is, as the video mentions, it's robotic assisted, and a robot needs to be connected to the patient during the surgery. I remember when the robotic surgery started, there were major issues, as if somebody would bump the frame that connects the robot to the patient, it would cause a frame shift in that the screws, which is what the robot is best at placing screws, all the screws would be misaligned. And this created some major issues in the past. Now, since then, there's been some innovations in this field, particularly in the world of augmented reality, which we'll talk about in a minute, and navigation. So there are many ways to make surgery super precise. And robotic sounds very innovative, but it is not the only way to really get it to 99.9% accuracy. This next question is from YouTube, and it's from Regina. She asks, "Hi, Dr. Brusavanik. My wife, Yvonne, had back surgery last year, and it didn't really help her that much." I'm really sorry, Regina. So her surgeon suggested that she get something called a spinal cord stimulator. Is that like electroshock kind of stuff? Can you give us the download? Because I'm a little nervous about it. Regina, I'm happy to hear you are so involved in your wife's healthcare. She's a very, very lucky woman. Spinal cord stimulator is to make you insensate to the pain. It does wonders for patients that are paralyzed and have pain related to the trauma. However, oftentimes I hear spinal cord stimulator being used for patients who have a real problem. And I always say to patients that in order to place the spinal cord stimulator, you have to have spine surgery. If you're going to have spine surgery, why not correct the underlying problem? Talk to your doctor and perhaps get a second opinion about whether your wife can actually correct the underlying issue. There are some innovative ways, minimally invasive ways nowadays to correct failed spine surgery. If you've got another question, we've got answers. And just in case you missed it the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've got a question from Jamarcus from Facebook. Jamarcus asks, "Hi, Dr. Brusavanik. I spoke to my orthopedic surgeon a few days ago, and he told me he's going to be using augmented reality goggles for my surgery." We just mentioned that. "I've worn them for some video games, but how do doctors use AR in surgery? As a gamer, I'm more curious than nervous." Jamarcus, that's an excellent question. Let's watch this video from Mayo Clinic, and then we'll talk all about it.
For people with severe back pain from arthritis or degeneration, often the last option for relief is spine surgery. Now, doctors are using augmented reality to achieve less pain with fewer complications for patients. Dr. Miles Hudson, a neurosurgery resident at Mayo Clinic, explains the innovation.
What it truly means is augmenting or enhancing your visual senses and your visual field, and that's what the augmented reality does.
By combining patient scans and MRIs, the technology allows the surgeon to see more without creating larger incisions.
Using those scans, our technologists can make the 3D models of the scan, and then we can use the 3D models and pair that to our neuronavigation software, and then by fusing those two together, you get a navigated 3D model that we can overlay through different visual devices such as a headset or the surgical microscope itself. It just helps elevate that safety to the next level by knowing where all the critical structures are and being able to actually see them through all the bone and soft tissue.
For the Mayo Clinic News Network, I'm Joel Streed.
Jamarcus, so I remember trying this technology out, and essentially there's a helmet that goes onto your head, and as I'm looking at the patient, I can see through them. It's as futuristic as it gets, but the reality is that it's a little bit over-technologized, because what we have now that's much more simple is looking at a screen and seeing exactly where the pedicles, which is a part of the bone where the screw usually goes, is supposed to go. So augmented reality, again, sounds very gimmicky and it's useful, but there are other alternatives. And the more technology you get to surgery, the more risk you get of that technology malfunctioning. It is an exciting world, though, and it's an amazing advancement. Now we're cooking. Up next is a question from Eva. which comes to us from YouTube. Eva asks, hi, Dr. Brusavanik, I'm 39 years old and I've been diagnosed with minimal osteoarthritis of the lumbar spine. What can I do to ease the pain and improve my condition? Hi, Eva. Thank you for sending in this question, and I'm sorry to hear that you're in pain. If you have minimal osteoarthritis and you are in pain, then the most important thing is that you are in pain. It's hard to judge the severity of symptoms based on the severity of findings on the MRI. Sometimes MRI is very bad and the patient's not terrible. Sometimes the MRI has early changes and the patient just can't live. Always try conservative care like epidural steroid injections, proper physical therapy. But if that fails and a patient continues to suffer, for young patients, there's now disc replacement. We can now maintain motion as opposed to placing screws and rods. We can get the patient's spine back to their original shape. So talk to your doctor about disc replacement, but also consider really maximizing conservative care with properly targeted epidural steroid injections. I guess it's a YouTube kind of a day. The next question comes to us from Hortensia, who asks, Doctor, 9 years ago, I had a spinal infusion on my L5. Now I'm in pain again, and I've been told that my L4, L3 are messed up. I have spinal stenosis on my back, not looking forward to surgery. What do I do? How do I make that better? Well, Hortensia, this is a very common issue. Essentially, when you have a problem with two bones that have been fused, it is very possible, for example, in your case, I'm assuming you mean L4-5. It's very possible that after a fusion surgery, the level above L3-4 or the level below L5-S1 will degenerate. And you see there are these nerves that exit at every level. So if you correct the issue with this nerve, you may start having issue with another nerve right below it. So consider getting a proper injection at the level above or at the level below, and make sure that that's exactly where the pain is coming from. If you can ensure that that's truly the source of your pain, there are very innovative ways to address what's called adjacent level disease, level above and level below, through this tiny incision made on the side of the patient's spine. Here's another question from our website, allhealthtv.com. Love it. Oksana's question for me is, hi, Dr. Brusavanik, what can you tell me about vertebral body tethering, VBT? I'm asking because my little Solnushka, Anushka, has severe scoliosis, and the doctor said that we need to get ahead of it. They said that these techniques will allow for growth and motion, and she's only 12 and still growing. They're good doctors, but they didn't do a great job explaining what VBT is. Would you mind filling in some of the gaps? Absolutely. So 12 years old is a little late for this procedure, but I have heard of this procedure being used in little kiddos who have a tremendous amount of growth left. And VBT involves placing these devices alongside the spine, hooked onto the vertebra, and the patient, after surgery, after recovery, comes back to the doctor, who then brings a special device right next to the patient's back, and it literally makes the device elongate or grow. So VBT essentially guides a crooked spine with scoliosis into proper direction of growth. But get a second opinion. Even though you think your doctors are good, 12 years old is a little late for that procedure. Definitely, please get a second opinion. You can never have too many. So people keep them coming. I really appreciate all these questions. Speaking of questions, here's another one from our Instagram page, and Brody is looking for an answer to this short but very topical question. Hi, Dr. Brusavanik. What are the latest innovations in spinal disc replacement? Hi, Brody. This is an excellent question. It's right up my alley because I do a lot of disc replacement. So with disc replacement, we correct the loss of disc height, which is always associated with disc degeneration. The operation is really done from the front, which is surprising to many patients, but because it can be done in a minimally invasive fashion, you don't really injure the abdominal wall. You sneak around the abdominal contents, and you arrive at the spinal disc without really causing any significant injury. You remove the disc and then implant a true mobile device that restores patients' disc height. but maintains motion. You don't have to sacrifice motion. And that's significant on many levels, especially because long-term, it doesn't cause the same issues with degeneration below or above the fused segment as you would with a fusion. With a disc replacement, you keep your motion and other levels don't degenerate with any expedited rate. I've been really blown away by this procedure because truthfully, most patients wake up and their pain is gone, and it's almost immediately after surgery. Talk to your doctor about disc replacement. You will be very pleasantly surprised without having to pay those long-term costs of adjacent level degeneration. Thank you again for coming to this episode of Ask the Doc. We really appreciate all of your questions, and please keep them coming. I'm excited to talk to you more about these very intricate issues. And remember to access our website, All Health TV, with a chock full of really important information.
Send in your questions to questions@allhealthtv.com or All Health Go on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.